Welcome to the Clearly Beneficial podcast, the show where we rip off the Band-Aid and explore the future of healthcare, benefits, and the people driving innovation in the industry. This episode is brought to you by Health Next, the company leading the way in helping employers build enduring cultures of health and well-being, reducing medical cost trends, and increasing organizational performance. To learn more how they can help you, visit healthnext.com.
Hey, everybody, and welcome to the Clearly Beneficial podcast. And I'm super excited today to have somebody I think is a real innovator in healthcare and in a place and doing a thing that is not going to be obvious to a lot of folks in what he does, but he's making some waves in the industry, and I'm excited to have him. So Mark Flores with AVYM, thanks so much for being here.
Thanks, Vinny. Appreciate it. Glad to be here.
Well, it's interesting because you and I got to know each other, it seems like earlier this year through some mutual connections. And as I was, putting together the podcast this year, you were on the top of my list to have someone to have as a guest because I saw what you were doing and I understood what you were doing in the market, and I'm like, damn, somebody's finally, trying to challenge the fox who's guarding the hen house.
Right.
So, you know, um, first, before we get into that, why don't you tell me a little bit about your background, and the origin story a little bit.
Sure. So we're based on the West Coast, the left coast, in LA. By the way, you probably noticed I'm drinking water from my championship mug here.
Awesome.
And we've been around, this iteration of our business has been around since 2011. So what is that, 24 years or so? Excuse me, 14 years.
14 years, yeah.
And before that, we were involved in my family business. My folks were in a claims billing and review company on behalf of providers, doctors, and hospitals. So
Okay.
that's kind of where I cut my teeth in this sector. I got to learn about claims processing and payments and reimbursements from the provider side. Fast forward a few years, and I think it was the Affordable Care Act that passed. Yeah, it was Affordable Care Act. And we kind of realized that the employers were gonna be held accountable on how they were adjudicating their claims. So we kind of pivoted, I guess, to include employers as potential clients. Now, you're probably thinking that seems kind of counterintuitive. Those groups, the employers and the doctors are typically at odds with each other, but we kind of realized from the beginning that the employers and the doctors should be friends because they were both sending money into this black hole, which is the
Two
middleman.
sides of the same coin.
Exactly. So that's kind of how this whole concept evolved. In the very beginning, it was tough because they would look at us and say, "You work for those greedy doctors. Oh, we don't want to deal with you guys on the employer side." So we had to really, really do the work and really plow the field, so to speak, and plant these seeds.
Yeah.
Luckily for us, over time, things have changed. Some of the stuff we were involved with, some of the stuff we weren't, but now today people start to see the light and realize that, yeah, there's potentially issues going on in the employer side of the healthcare claims transactions.
No, and for the listeners, I want to make sure that I want you to stay hooked here because what Mark is doing, you hear words like, I mean, I always jokingly say I could say the word deductible and I can hypnotize you to sleep. Okay. But in this case, we're going to use the word claims and claims management and all that stuff as another word that can put you to sleep. But let me tell you, this episode's not going to put you to sleep because there's so much intrigue that is going on that most people in the industry, brokers, providers, employers have no idea what the deal is. So we're going to be digging into a lot of that. Because I love this origin story, Mark, because it's like it's a family. It was the family business. You learned claims because your folks were in it, and that literally speaks to 0.00001% of the population. I mean, you're like a unicorn for that
And not only that,
background.
but it was from the other side. It was
Yeah.
from the enemy.
Yeah, yeah. So So it's interesting. Where I'm going to frame the conversation today is, when you and I met, I immediately, because as having been a broker for over 20 years, I immediately knew where you were coming from. You know, I was always like, I was the guy as a broker who would like sit there and I would review the large claims from my clients, and I would go, huh, and I'll never forget the time I saw a claim, $250,000 broken legs, and those were being attributed to my client. And I was like, what could have caused two $250,000 claims for broken femurs? And it turned out it was an auto accident, yet the insurance company simply paid the claim, and they didn't do any diligence on whether there was somebody to subrogate against to get that money back and not blame my employer for it. So instead of my employer being on the hook for $500,000, I was able to get that claim waived and had that insurer go after it for the auto insurer who was part of the claim on the other side. And I'm sure you see that all the time.
Yep. The only caveat would be we see it, but where we see it where the employer paid the claim,
Right.
but the doctor or the hospital never got paid. So,
Oh, and that's where this whole thing gets more interesting.
right. That's a little difference
No,
there.
this is where it all gets very interesting. So what excited me about talking to Mark is, and I was jokingly telling him before we started, we're going to call this the F word episode. And the F word that I'm talking about today is fiduciary. And maybe Mark, give us some perspective on what that really means. An employer should be mindful of the money they are spending on behalf of their employees, right? And that makes them a fiduciary.
Yeah, so that's a $10 word that gets thrown around a lot. And really simply stated, a fiduciary is somebody who's supposed to act in the best interest of their members or participants. So what does that mean? That means as an employer, do I go out and shop the cheapest, vendor? Maybe, but is that affecting or adversely affecting the employees? Is it better for the employees if I get a vendor who's a little bit more expensive, but that vendor does, maybe has more services that protect the employees? So
Right.
as a fiduciary, you're required to do what's best for your members or your participants. But at the same time, and this is where it's difficult, it's a balancing act, they have to act reasonable with respect to the expenses. So at the same time, they can't go out and get the Rolls Royce of vendors, if they can get a Toyota vendor who's going to do the same service for half the price.
Right.
So it is a bit of a balancing act. But at the end of the day, most employers don't have a problem shopping for price, but a lot of times they do have a problem comparing services for services, which is where consultants and advisors and maybe even brokers come in to
Yeah.
help the employer kind of make sense of these various services and the different services so that they can really get a sense of comparing apples to apples versus, something that's completely off the wall.
Right. But wasn't there also some federal legislation in the last couple of years that has highlighted the role of the fiduciary, that there is, and I forgot the designation. Maybe talk a little bit about that.
So I'm going to go into the alphabet soup of regulations here, but in the 70s, they created ERISA, which is the Employee Retirement Income Security Act. And the reason they created that law was to protect the benefits that employees and their dependents and spouses get from their employers. So
Right.
those rules have been around for a long time.
Right.
I think the rule or the law that you're referencing came, I think it was the first Trump administration that passed, and that was called the Consolidated Appropriations Act. And
Right.
essentially, what that tried to do was create transparency. They basically said, look, doctors, hospitals, you got to post your rates. Employers, you got to find out what fees you're paying, and you got to make an attestation to us, every year that you looked at your fees and that you can attest that your fees are reasonable. Now, this is obviously an oversimplification, but basically, and there's some other issues that were addressed with that law. But as far as the employers are concerned and relate to our discussion, those are the two main issues. So, number one, the employer has to be able to see their fees and make a determination as to whether those fees are reasonable, and then file this thing called an attestation. It's a
Right.
declaration.
Right.
So that's important because the employer has the responsibility and obligation and the liability if they don't do it. Well, what's the big problem with that? It should be the employer, right? Well, maybe not because most of the employers have delegated those responsibilities to their administrators. And that's what's created this kind of disconnect where
Disconnect. Yeah.
the carriers, for example, or the administrator, they're not bound by the CAA necessarily. It's the employer who has the obligation, the fiduciary obligation, as a matter of fact, to make the attestation that the fees are reasonable. Now, if the employer can't see the fees, then how can they possibly say that
Right.
the fees are reasonable, right? And that's kind of the big problem in this whole
But also those
third-party
fees
healthcare.
ostensibly roll down to the employee, right? Because that employee is going to be responsible for paying health insurance out of their pocket potentially, and any number of claims, out of pocket costs. And so I always used to joke that Cobra, for example, most employees in a company don't know that they are a Cobra compliance officer. If they don't get the initial notice on the right time, if they don't get the termination notice at the right time, if they don't get enrolled properly, if they elect Cobra. So there's a lot of arcane rules, and this is why brokers, the crazy ones still do it. Take that Cobra administration in house, and the ones I worked for, we got rid of it. We used to bring in third party administrators to
Yep.
administer the Cobra to shift the risk. But where I'm going with this is Cobra, an employee, very rarely would an employee say, man, I never got my notice. Oh, and I had, all the things would go wrong. They themselves turn into Cobra compliance agents. Do employees sort of play the same role with fiduciary responsibility? Do they have, quote, standing to say, my employer is not acting as a fiduciary?
So that's a good question. And I would say yes. Um, and I look at this from two different perspectives. The first perspective is, hey, I'm getting screwed, and my employer is not doing their job to protect me. They're not acting in my best interest as a fiduciary. I'm going to call them out. I'm going to call them out. Okay. The other perspective is the employees, excuse me, don't forget, are also typically nowadays making contributions out of their paychecks to their benefits.
Yep.
So a lot of that money or a certain percentage of that money is their money, as
Right.
well as the employer's money in the
Right.
self-funded space, right?
Yep.
So now the flip side of that is if the employer is not monitoring and overseeing the plan assets, they're potentially harming the members because some of that money is theirs.
Right.
So it's this weird, again, this weird balancing act that the employers have. They have to make sure that they're protecting their members. They have to make sure that they're monitoring the plan assets. And a lot of times it's difficult. Now, if you're thinking about is the employee a kind of a monitor, so to speak, or are they kind of a guardrail? And that really hasn't been our experience. And the reason is think about what this is. These are benefits for healthcare.
Yep.
When an employee is using this benefit, there's something wrong with them.
Yeah.
Heaven forbid it's a catastrophic illness or some serious chronic, acute disease, but their concern is getting better.
Right.
Their concern is getting well, or their kid or their wife or their husband. They're not necessarily concerned about did they check off all the boxes? Did I get all my notifications? Now, when the claim isn't paid, of course, that triggers all the alarm bells. And so in a sense, that happens, but even in those cases, it's difficult for the employees to really act as a guardrail because of the
Well, they
nature
don't
of
know.
healthcare.
They're not educated, and they don't know. I mean, most employees couldn't tell you an iota about Cobra, let alone something another layer, which is fiduciary responsibility. So I want to dig into sort of a little bit of the nuts and bolts as to when your company has an opportunity to help someone. And I thought it was like when I first learned about this, it was like the coolest thing. So for the listener, I want to say we're going to get maybe a little bit arcane in sort of how health plans are funded, because you're now going to learn something that 99.9% of the population doesn't know. Okay, I mean, when an employer buys insurance, health insurance for their employees, they can do it in a number of ways. The simplest way to do it is called fully insured. Employer writes a check to an insurance company provides insurance to the employees. Everything is run by the insurance company, and the employer doesn't get involved in much of the detail. Okay, they just take what's off the shelf of what an insurance company offers. On the other side of the equation is something called self-funding. Self-funding is where an employer says, hey, we're going to pay the claims up to a certain amount. And then after that amount, we have what's called stop loss insurance to protect us against the high claims. But in the meantime, we're going to use our cash flow to pay for pay for claims as they are incurred by our employees. And so the advantage of that, there's certain tax advantages to that. There's some flexibility to that. In California, for example, these plans are subject to federal law, not state law. So there's certain mandated benefits that don't end up in those plans, and that's, in certain instances. But I jokingly say, if the Lamborghini is either paid for by fully insured, you're buying a fully built Lamborghini over here. In self-insurance, you're literally building the Lamborghini yourself. You're picking the insurance, you're picking the stop loss, you're picking the network, you're picking the pharmacy, you're picking a whole bunch of things, and you're slapping it on the chassis. But then there's this little eensy, not eensy weensy, but a pretty big niche in the middle, where enterprises, normally with companies or municipalities with 10,000 or more people, or even smaller, but let's start with 10,000 or more employees play, and that's sort of, I call it hybrid land. Okay, that's where I call the fox guarding the hen house, where the employer contracts with an insurance company that is the one also selling a fully insured contract, and they themselves buy a self-insured contract from that insurance company. So the insurance company is really taking everything they have off the shelf, but wrapping a different financial structure around it in order to have the employer have the tax benefits and ERISA and all these other types of things. Did I get that mostly right, Mark?
Yeah, so that's a good question. So let me just add a little clarification.
Yep.
The funding structures themselves are not necessarily tied to whether it's federal or state law. And the reason is you could have self-insured, as you said, uh, state benefit health plan, right? That's not subject to ERISA. That's subject to state laws, right?
Right.
The point is the funding mechanism is really the key aspect because, and I'll use your Lamborghini example. I love that example, even though I hate comparing health insurance to auto insurance. For the funding mechanism, I think it's a good analogy. And the funding mechanism is very simple. You buy auto insurance, particularly here in California, and after your 30-day grace period, you pay 300 bucks a month. And the second month you crash your car and it costs $10,000 to fix your car. It doesn't matter. You paid your $300 premium. The insurance company now is stuck paying the 9,700 balance,
Right.
right? Because you paid 300 to fix your car. But that's an insurance policy. That's fully insured. The difference is if you were to buy a self-insured type contract policy through your car insurance company, you would have to have pre-funded your policy with the amount that your car is worth.
Mm.
So if they would have said, okay, you're going to buy this policy, great, we need a check for 10 grand. You're like, what do you mean? Well, you're paying for this. So if you crash your car tomorrow, I'm not going to pay this. You got to pay it. So I need you to pre-fund 10 grand in case you crash your car. Oh, and by the way, every month thereafter, you're going to pay me 500 bucks. Okay.
Yeah.
That's the fundamental difference. That's how the analogy I would use. Now, going to your question about these administrators who are administrating these self-funded, pre-funded, right, insurance policies or plan benefits. the culture is simple. You're on a member employee plan. I'm on the same plan. Mary's on the same plan. Joe's on the same plan. We're all kicking in $100. That's our money. Joe goes to the doctor for a broken fingernail and he gets $1,000 bill. We're gonna tell Joe, hey man, knock it off, dude. That's our money too. Like, why are you going to the doctor for a broken fingernail, right?
Right.
So it's the same concept, the same idea. The same concept is that the employers want to try to protect that money. They want to try to prevent some of these employees from, using these services for frivolous care that they maybe don't need, right? Now, that's the general idea behind how this works. You want to protect those assets and make sure they're available for catastrophic illnesses.
Yep.
But now, when you're talking about the administrator, employers will typically hire an administrator. Sometimes they're large national carriers, sometimes they're regional. They call them TPAs, third party administrators. It just varies, right? Sometimes they self-administer, certain unions do that. And the idea behind that is, hey, I make truck parts, okay? I don't know anything about healthcare. I'm hiring you for your expertise to make sure that my members, A, get the care they need, but B, if you see some of my members going to the doctor for ridiculous stuff, let me know. And B and C, if you see some of these charges coming through that are crazy, let me know. It's real simple, right?
Yep.
But that's not what happens. What happens, at least in our experience, is the employers hire these administrators, and the administrator, don't worry, I'll take care of everything. When the employer has a question about a claim or expenses, the administrator gives them information that in some cases doesn't really truly accurately represent the specific charges from the doctor or the specific payment to the doctor. So you're probably asking me like, wait a minute, Mark, what are you saying?
Right.
Um, if it doesn't represent that, what does that mean? Well, what that means is that typically there's fees built into these services, and a lot of times the fees are taken as part of the claim dollars. So if the doctor bills, $1,000, and the insurance company or the TPA says, hey, I have to charge you a small fee for this, maybe I have to charge you $100, right? So now the $1,000 bill goes through. But the insurance company needs a $100 fee, so that bill has to be $1,100. The $1,000 payment plus their $100 fee. You follow?
No, if I completely follow, I mean, in fact, what
So
I
that's
remember,
how, I'm
yeah.
sorry, but that's how you can get a claim dollar amount that is above what the actual claim payment is or should be.
Well, isn't it true? If I recall one of our early conversations, it even gets a lot more egregious than your $100 example, right? It gets to the point where, the middleman, meaning the carrier-based, insurance company-based, administrator is saying, okay, well, Joe went and got a new knee at the surgery center. The surgery center, billed $5,000 for the knee. They build the insurance company, they adjudicate the claim, and they go, well, on our fee schedule, we're only going to pay you $2,500. And so they have documentation from the surgery center saying, you owe us 5,000, but now we're only going to pay you 2,500 because that's our contracted rate. But yet, what they bill the employer for that procedure is the $5,000. Is that accurate?
Yes. So this is really, we're simplifying this process. There's all kinds
Right.
of other
I know
factors
that, but
involved.
for the
But
listener, I want to make sure that the
right.
broad listener kind of grasps the deal.
So there is going to be typically a fee in the contracted rate as well, right? So
Right.
it might not be 2,500, half, 50%, that's a lot, but maybe the bill's 5,000, the contracted rate's 2,500, so they take 3,000 from the employer. So
Right.
it's maybe, 500 bucks, right? 20% fee. Okay, that's a lot. But what about if you're non-contracted? What if you're out of network? Now
Hmm.
what?
Yeah.
Now the 5,000 bill comes in. There's no contract. Do they pay the surgery center 5,000, the full bill charges?
No, not usually.
Rarely, if ever,
Right.
do they pay. But yet they turn around and tell the employer, "Oh, I need $5,000 because there's no discount on this claim because this guy's out of network." Now, what they'll do is they'll say, "Guess what, Mr. Employer, you're in luck today. Why? Because I'm going to go down there and I'm going to negotiate and make a deal with this doctor and save you money." So the employer gets happy and says, "Oh, you're going to save me money." "Yes, I am. But I'm going to charge you a percent of the savings."
Hmm.
Now, on the surface, that sounds cool. That sounds great. You're
Right.
going to go fight for me. You're going to go grind these greedy doctors down. You're going to make their bill reasonable and you're going to save me money. Great. But there's only one problem with that. Number one, how do you determine the savings amount? What is considered savings?
Right.
And I'll give you an example. If I'm a man, a male, right? If I go into a hospital and I get a gynecological procedure, right? They do a gynecological procedure, or they at least bill for that.
Right.
Maybe they don't do it, but they bill it.
Right. Right.
So now the insurance company gets the bill and they look at the bill and they say, wait a minute, Mark is a guy. We don't see any record of any sex change operations here. They're sending a bill in for a gynecological procedure. Okay. The insurance company would normally say, that's not covered. We're rejecting this claim. We're denying it or rejecting it. It's not covered at all. There's no negotiating, there's nothing. We don't cover that, right?
Right.
Now, what if the insurance company says, or the TPA, excuse me, says, hey, Mr. Employer, we got a claim from Mark. It was $10,000 for a gynecological procedure, but we paid zero. And guess what, Mr. Employer? We saved you 10,000 bucks. Is that right? Does that make
Right.
sense?
That makes sense. Sure.
It does? Okay,
Well,
how
no,
can
no,
you?
it doesn't make sense because they didn't save them anything. It was something that should just been rejected out of hand.
Exactly.
Right.
And that's the fundamental problem with these shared savings programs. It's very, very difficult to figure out what should have been paid, what shouldn't have been paid, what the discount really is. How are you basing the discount? Is it based off of bill charges? Is it based off of some contracted rate? Is it based on, some other number that I have no idea what you're using? And then not only that, but if I can't see as an employer what the actual payment amount is, well, then how can I ever confirm or validate that the discount amount and the fee you charge me is correct, right? So there's a lot of inherent problems with that model, and that's one of the things that we look at when we are hired by employers.
And so now it's you put on your miner's hat and you start to dig through, and I would imagine that for an enterprise that's processing that 10,000 plus employees that has, thousands upon thousands of claims a year. I mean, when you sift through, and I'm asking you to probably make a very broad general statement here, but when you sift through the wreckage, if you have access to the data, which I'm sure is a whole other conversation, but if you get access to the data and you're sifting through all the information, what percentage of claims would you potentially find as actionable to call into question?
So this is only based on our own historical experience. And we're looking at conservatively 15%
Okay.
up to 25, 30%. So what does that really mean? So the way we assess this questionable claim spend amounts, right? We base that on the actual claim spend itself. So if you're an employer and you're spending $1 million a year on medical claims, this doesn't include your PMPM fee. This doesn't include commissions. Those are all
Yeah.
itemized separately. This is just what the insurance says you paid in medical claims this last year, a million bucks, right? We are typically seeing anywhere from 150,000 to 300,000 of that million, which is
And a million
never,
is nothing. I mean, in terms of group size, if you're at a 10,000 employee level,
it's a
you're
100 million.
looking at could be 50 million, could
Yeah.
be 100 million in total claims
So
dollars.
let's look at the 100 million number. So what we're looking at is between 15 and 30 million per year of the 100 million
Wow.
spend is potentially fees that haven't been disclosed to you.
And this is stuff that just goes on every day.
Right. So the next question I typically get asked is, well, is this a one-off? Are these exceptions? How often does this happen? Like, what's the percent? Usually they ask, what's the percent of employers that this is happening to? Like out of 10 employers, how many is this happening to? And based on our experience, 8 out of 10.
Wow. So that's a very big statement in that I got in my old age, I guess I've just gotten a little jaded about the business in general, but hence why I'm doing the podcast is to shed light on stuff that people like you are doing. And I just view that this industry, healthcare, employee benefits, in many ways, I see it as the blind leading the blind. And you've got a broker who's involved who is interested in their paycheck. You've got an HR person who, bless their heart, is overworked, underpaid, um, you know, should be really engaged in benefits. A lot of them aren't educated on benefits, certainly not the arcane financing of benefits. And so I think a lot of those are not as engaged on the money side as they could be. You take the finance side of any company, CFO, et cetera, controller, it's interesting the cultural issue here. Culturally, CFOs and others in the financial side of the house have abdicated their responsibility of the health plan to HR. So there's nobody really minding the store, and the CFO is running the business, right? And so there there is a need almost, and I've tried to say this for a couple of years now, that there just needs to be almost a cultural revolution around who's minding the store about the cost of healthcare and benefits, right?
Yeah, and let's go back to this earlier analogy we made about Joe, who's going to the emergency room every week for his broken fingernails, right?
Right.
The whole company's mad at Joe because he's wasting money. But meanwhile, they're bleeding 20% of their total claim spend annually,
Yeah.
right? So it just shows you how the system is kind of tweaked and the narrative that's been created is not entirely accurate. You know what I
Yeah.
mean? Is Joe spending 20% of the claim spend, with a broken fingernail? No way, likely not,
Yeah.
right? But
Yeah.
but yet they're blaming him. And so that goes back to this idea that, oh, these high cost claimants, these people who are sick, they're driving all the expenses. Yes, that's true. They are driving expenses to a certain extent because of the nature of their illness, but are they really driving 80% of the spend?
Right.
If 20% of
Right.
that is going out to a fee, I mean, what does that really mean? And how do how
Right.
do you how do you fix that problem? And so that kind of leads me to the next segment or issue is what we try to do here is simply create transparency. That's really all we're trying to do. We don't engage a client, an employer client, and tell them, oh my God, we think you're getting ripped off, you're getting screwed. If they ask us what our historical findings have been, we'll be honest with them, but we're not going in there looking for fraud. We're simply going in there to say, look, what does your contract say? What are the terms in your contract? Are any of the terms in your contract potentially problematic for you? Okay. Number two, are you getting any data? Any data? You are? Great. Let's take a look at this data. Let's ask questions about this data. You're not getting any data? Fine. Let's go get some data
Yeah.
and let's look at this data. Number three, we're finding problems with this data. Can we fix it? What's the remedy? Maybe there are no problems. Maybe there's out of those 8, 10 employers, we get 2 of them that, oh, it's pretty clean. It's pretty straightforward. Everything's clean. You're okay. Not to worry, right? But if you're one of the 8, what are you doing? What's your remedy? And this also goes full circle back to what you said earlier about fiduciary obligations. Now, most people, even non-healthcare people, would agree that yeah, you should be able to go back and look at your spend and figure out if the invoice is correct, right? If the services were provided and the payment amount was the correct amount.
Right,
You hire a plumber, he comes to your house, he gives you a quote, hey, it's going to cost $300. Great.
right,
He fixes your pipe, you charge the credit card, boom, you're done. The
right,
next day, you look at the invoice, you say, okay, he charged me 300. You go check your pipe, my pipe is not leaking anymore. Cool. But then you see your credit card, you see a $600 charge. Like, wait a minute, something's wrong here, right?
right,
Very simple.
right.
There's no reason why the same thing should not be done and cannot be done in healthcare. And I think that's at least me personally, I think that's the very first step before you really talk about making, systemic changes or eliminating the middleman or the population health management, redesigning the plan. I'm going to get technical, right? But
Right.
before you go into all those very sophisticated solutions, you really need to get an idea of what you're really spending on healthcare, and i.e., payments to
Absolutely.
the doctors.
Absolutely. Absolutely. And that is, at that, as you're talking, I'm thinking about just even the average member of a health plan. Okay, they've now gone through some procedures, a multitude of things leading up to an illness, and all of a sudden the EOBs start coming in, the evidence of benefit forms start coming in, the bills start coming in, and it is almost physically and mentally impossible to match up the EOB to the bill because multitude of things could be on any one of those things, and then people freak out, and then people get sent to collections because they don't really know what the heck's going on, because it's very stressful, especially now with more high deductible plans and other plan designs that are out there. The individual member of a health plan has it's almost powerless. But where I was going with that was, especially now, where I mean, I remember when I started in the industry, 2003, I could insure a individual working for an employer for about 150 bucks a month, 400 bucks for a family, right? Here now, 2025, we've just about added a zero to
Yeah.
both of those numbers. I mean, the single premium for an employee on average is about 1,000 bucks. It's tipping 4,500 or more, or for a family, and employers are sharing more of that cost with their employees because they can't afford to pay for it all. So there's more cost shifting. Deductibles are going up. Um, Employers, I think, absolutely have an imperative to make sure that the money they are spending is legit. Because if what you're saying is true, and I have no reason to doubt you, um, if an employer of an enterprise digs in and understands what's going on, well, then, if I can shave 20%, pick a number, 15, 20% of my annual healthcare spend because of things that are being misrepresented or overbilled or whatever it might be, I can literally almost reset my health plan and because my rates and everything are going up 10% a year. Well, I got to reset that somewhere, and this is, I think, just one means by which it can be done. There's a lot, I don't want to go down this road, but there's a lot. Mark Cuban is going off on a lot of pharmacy benefit managers, and he's doing a lot, raising the bar. He put up a post that I commented on talking about employers' fiduciary responsibility for for pharmacy. And I commented and I said, why stop at pharmacy? I go, what about the pharmacy represents 30% of the spend? What about the other 70% of the spend, which is medical claims? You know, and let's just say, he liked the comment and it got a lot of views. And I think that's where that is an important thing for employers to recognize, is that there's money sitting on the table that's yours, that you're spending, that you should be able to claw back.
Yeah,
So
we
I want
call
to
it
seg
we
I
call
want
it
to
couch cushion money, the money you
couch,
didn't know you
a lot
had.
of couch cushion money.
That's
So
right.
again, as we talked before we started the record, I want to have you spend a couple of minutes sharing what you want to share. You were involved recently in a large settlement. Um, uh, saving an entity a huge amount of money and finding a huge amount of money. And I'd like to give you an opportunity to talk a little bit about that to the extent that you're comfortable and what's public, et cetera.
Sure, sure. So we were, myself and my other partner were involved. We were the primary architects of this case that was filed against Horizon, Blue Cross Blue Shield Horizon, New Jersey, on behalf of the state of New Jersey. I think they call it the SHIP program or the SHEP or something like that. It's the state employee benefit health plan. And it's pretty big. It's a huge plan. Um, so we brought this case up. The state of New Jersey Attorney General took the case and ran with it. God bless him. And ultimately, after the investigation, after we kind of pointed them out to where to look, um, they negotiated $100 million settlement with Horizon.
Wow.
And that my understanding is that was the largest non-Medicaid settlement in state history.
Wow.
That's a big, big number. I mean, that's a lot of money, right?
That's a big
Regardless of
number
how you
for
slice it.
and how many employees were involved in that enterprise?
I think the state has a few 100,000 employees, I believe,
Okay.
but here's the takeaway. The takeaway is, and you kind of alluded to this earlier, you don't have to believe me, right? If you believe me, great. But all you have to do is do a simple search and use a skeptical eye, and you'll find cases after cases or situations after situations of this type of activity going on. Now, in the New Jersey case, the state attorney general ultimately went after Horizon because they were not complying with this thing called the lesser of provision, which basically means if you have a bill come in, but there's a contracted rate, you theoretically have two different amounts. We, the state, will always pay the lesser, whichever is the lesser. If the doctor bills low, we bill that. If the contracted rate is lower than his billed amount, then we pay that, excuse me. And so that was the essence of that lesser of. It makes sense, right?
Right.
Ultimately, the state realized that they were not paying the lesser of. They were in many cases paying, the higher amount. And, the state in their press release, they mentioned that when they had negotiated the contract with Horizon, Horizon had agreed to comply with that provision. They said, "Don't worry, we'll take care of that. We'll pay the lesser of." But they didn't. And when the state found out, at least according to the court documents that I saw in the state and the AG's press release, Horizon said, "Oh, we're sorry, we couldn't do it. We didn't do it because our systems couldn't do it. It wasn't because
Mm.
we didn't want to, we just couldn't." And of course, the AG got even more upset. He's like, "Well, then why
Yeah,
did you
it's not
guys
an
lie to me?"
excuse, is it?
Right? He goes, "Well, why did you lie to me and say you couldn't do it?" Right? So that was a huge piece of this, settlement amount. There was some other issues that were related to services that were not being provided, I think. They were paying for certain services that were not being provided. But that goes back to the plumber. Hey, you bill me $300 to fix my pipe. Did you fix my pipe? It's very simple, right?
Yep.
So those were a couple of things that were specific to the Horizon case, the New Jersey case. But all you have to do is, like I said, look online. There's Tiara Yachts versus Blue Cross Blue Shield Michigan. There's Owens Minor versus Anthem. There's the there's one in I think it's in Massachusetts, trustees, labor and welfare trustees versus Anthem. I mean, there's a lot of cases. There's Aramark versus Aetna. There's Kraft Heinz. Everybody knows Kraft Heinz, big company. They're fighting with their TPA, insurance carrier Aetna. Those are all lawsuits, public information. A lot of them unsettled, which tells you if it settles, then
Yeah.
some of the stuff might have been true, right? But the
So
point is,
it begs an interesting question, and I'm just curious because I want to kind of sort of I appreciate all that insight because it's so valuable to know that people are you know fighting the good fight. Let's just put it that way. But it makes me think of like class action suits that get settled, and all of a sudden someone wants to sell you give you a check for $4 because you were part of the class. I mean, does any of that 100 million flow back to the employees?
Well, if it flows back to the employees, I can't answer that, but I can tell you that a substantial part of it, I think 80%, actually went back to the plan itself. So that was money that went back into the pot
Right,
to pay for these claims. Now, and I've seen a lot of articles and I've seen a lot of commentary about, well, it's so little bit and this and that, but I think people are kind of forgetting the real point, which is, yeah, there's some money. Maybe it's not enough, or maybe there could have been more, but now the state is aware. Now
right,
the state can mitigate this activity going forward.
right,
And more importantly,
right,
other entities that are involved in their own benefit plans should look at this example and say, maybe we should look at this too. Maybe we should look at our
right.
own plans and our own providers just to make sure everything's
I would imagine that, I mean,
good.
as you're talking about larger enterprises starting to look at them, probably large union plans should be looking at them, large school districts. I mean, anything with that number of 10,000 or more employees really should be looking at this. And so, no, I mean, it really, I think, is a great work that you're doing. When I first met you, I was super impressed by
Thank you.
you and what you guys are doing, because again, it's you literally have, you put your miner's hat on and grab your pickaxe, and you go after it in I would use the term forensic kind of way, to
Yeah,
just understand the money flow, who owns what, and if the client is deserving of some of that money back. But more importantly, like you just said, it's it's free, it's creating a precedent for the future. Once we've
right.
done the math, once we've figured it out, once we've looked behind the last couple of years, now we look forward and we have safeguards in place so this doesn't happen again. And I think that is super important. And you're doing something in an area that nobody knows about. So I'm happy to bring what you're doing to light, and have the market understand what you're working on.
Think of it, Vinny, as a intersection, a traffic intersection. You have stop signs, right? And you go through the intersection every single day on your way to work. And over time, you stop stopping. You just go right through it because there's nobody ever there. You're in a hurry.
Yeah,
So you got to have a traffic cop sitting right there in the corner. So now you blow the stop sign, he gives you a ticket. Now you remember, oh man, I got to make sure I stop at that stop sign because there could be a cop there. He got me last time, right? That's what this is. It's human nature. There
yeah.
has to be accountability. Somebody has to be monitoring this. And the parties have to know that, yeah, they're keeping an eye on me, so I gotta make sure I do the right thing here. And
And
that's it.
it's
It's a
unfortunately,
huge
it's sad
piece.
that we have to operate like that, but it is what it is. You know, I had a client, who passed away a few years ago. He was French and spoke with a very pronounced French accent. And every year I'd come and do his renewal with him. Every year he would call the insurance companies the greedy bloodsuckers, you know, and I am not vilifying insurance companies. There's so much blame to go around in healthcare that I can call them all that. There's everybody's got their fingers in the pie, but I always got a kick out of that every year when
Yeah, and let me clarify, Vinny. Um, I mean, I'm not necessarily of the opinion that we should get rid of them and we should change the entire system.
right,
Because think about it, these large, especially the large national insurance carriers, they're deeply embedded into the financial system.
absolutely,
Institutional investors, for retirement plan investors, individual investors basically own a piece of these companies.
yep.
So unless you want to turn the market upside down, right, you want to
1/6 of
proceed.
the economy. I mean, come
There you
on,
go. So
you
you want to
know.
proceed cautiously. Now, that being said, all we're saying is let us see what's going on with our money. Let us see where it's going as the
Yep,
employers. We have a fiduciary, the F word, responsibility to do so. And we just want to make sure that we're paying the amounts that we're supposed to be paying. That's it.
yep. That's it.
And I
Simple.
think it's difficult for anybody, I think, to say, well, you shouldn't have the right to see that. You shouldn't be able to see that information
Right,
for whatever
right.
reason,
Yeah,
right?
yep.
So just to be clear, I'm not advocating that we eliminate these insurance guys and these national carrier
Right,
guys.
right.
I'm just saying, and I actually firmly believe, I have confidence myself in the employer community to police themselves. I think if the employers were able to see everything, I
Yeah.
think that would really go a long ways in
Yeah.
mitigating this crisis in healthcare, right? I think that's number one. Number two, I also think that based on my experience, maybe some of the folks out there might not agree, but I think most employers do want to do the right thing for their employees. I really do. I think they want to
Absolutely.
make sure their employees have care and access. And I've had
Absolutely.
situations where the owners, the principals, the executives were getting cancer treatment. So those guys were invested, obviously. So I think the employers, people maybe sometimes shortchange them a little bit, but I think they have the capability to do the right thing, and I think they have the desire to do the right thing. I just think they need the right tools.
No, exactly. You're empowering them to take back control of a facet of their health plan that they don't even know they have the ability of taking back. And
Right.
and I think that's the cool bit of what you're doing. So Mark, I appreciate all your time today. What you do is fascinating to me because
Thank you.
it's so important to the market to know you're there. And there's a resource to go out and find you money that you may not otherwise know you have. So that's cool. So as I mentioned before we started, I have a wine Instagram called Vines with Vinny, and always have a good time with it. And I'm always now asking my guests, I'm interested in if they drink wine. Do they what are they what region, what grape, what wine? I mean, do you like wine?
I'm actually from California, LA, so we're big wine people here. Everybody drinks wine here. I
Yep.
love wine. I would say, I'm partial to Napa, California wine. But I went to Bordeaux with my wife a few years ago, and it was incredible. It was absolutely incredible. I have a newfound appreciation and respect for the French wine and the winemaking process. I love the Pinots from Oregon. I think they're fabulous.
Yep.
I don't know if you've had some of the whites from down south, from Valle de Guadalupe. They're
No.
they're pretty nice, very nice.
Okay.
Um, so the craziest, weirdest place I had wine from here in the States was probably Pittsburgh, Pennsylvania.
Wow, I didn't know that. I know they grow wine. I know they grow grapes. A friend of mine actually just bought 30 acres up in the Finger Lakes region of New
Yep.
York. So
Finger
he's
Lakes is
growing
well
Riesling
known
up
for their
there.
whites. Yep. They're dry Rieslings, they're beautiful
Yep,
wines.
yep.
But Pittsburgh, Pennsylvania, I was there for work a few years back, and they had a little wine shop and they had local wine.
That's fun.
And I just thought that was so cool. I thought that was awesome.
No, let's talk about Bordeaux for a quick second, only because earlier this year I got to go to a wine event in New York City, which was hosted by this organization of this was 68 chateaux from Bordeaux. So
Wow.
I walk into this magnificently large, event center. Each each winery had a table, and I made my way through about a third of them, and they were presenting the 2022 vintages, and they basically said the 2022 is literally the best Bordeaux vintage you could buy. And so
That's
fell in
really
love with
good.
some fell in love with some of those. Went to Total Wine, bought some of those, and I did something a few weeks ago that was a little mind blowing. Walked into Trader Joe's. I never look at the Trader Joe's wines. Walked into Trader Joe's. They have three different 2022 Bordeaux's, and they're not like Grand Cru. I mean, they're a little, they're down the food chain, but they were $10 a bottle. How bad could they be?
Wow.
And next time you're in Trader Joe's, go find them. Worth the 10
That
bucks.
are you partial to any of the appellations over there in Bordeaux? Or is there a
I
particular?
I'm still learning. I mean, this was my year. I jokingly tell people it was my year of the French because my tastes have been popping all over the place, but France and Bordeaux in particular has been what I've been trying to drink mostly this year, and I'm still getting my palate around the region and learning.
Well, good for you, Vinny. Appreciate that. It's been great talking to you. I'm gonna have a glass of wine tonight, actually.
No, I hear you and I appreciate that. So, Mark, thanks again, and we'll talk to you again. Take
You
care.
got it. All
All
right.
right. All right. Bye
Bye-bye.
bye. This podcast reflects the personal views of the host and guests, not their employers or sponsors. See you next time.